Phil from Phil Will Expose. Today's episode, I have a very special guest who goes by the name of Zac Cupples. So, welcome aboard.
Phil, I'm incredibly excited and happy to be here. And I'm really happy that there were a bunch of questions that have been asked by this person, and they'll be answered for the people by this people right here. Fam recognized fam.
Yeah, man. So, I basically found out about you for all of you who are curious watching. Had a coach I was working with in Montreal named Rich Daw, and he basically introduced me to a couple of different strength and conditioning coaches and postural restoration coaches as well. And he basically told me about someone named Lucy Hendricks. Basically, I discovered her work. Then it led me to discovering Zac Cupples, along with other people who you might see on this channel later on. So I'm excited to see us today. Excited to see what we're going to talk about today. And yeah, you mind just introducing yourself to the audience?
Yeah, sure. And you should get Lucy on. She's a very smart person. But my name is Zac Cupples. I'm a physical therapist, strength conditioning coach, writer, among other things. I currently live in Las Vegas, Nevada. I've been practicing physical therapy since 2012, so that's about 8 years now. I've worked all over the U.S. in a lot of different settings, ranging from hospital-based PT to National Basketball Association to travel physical therapy, and now my current job is at Elevate Sports Performance and Healthcare, which is a hybrid training rehab facility in wonderful Las Vegas. And then my other gig, which I've been doing the whole time, is my website, zaccouples.com, where I've been doing a lot of remote assessments with people. I do movement consultations, I do training, I do mentoring, and then I also teach a seminar called Human Matrix, which will dive into a lot of the concepts that I think we will talk about today. So it's about, a lot of my passion is to try is kind of similar to what you're trying to do, Phil. Is I try to take complex topics and I make them ridiculously simple. And so the website is kind of the didactic and learning portion, and then the seminar is more the let's apply this stuff so you can help your people or yourself reach your movement and fitness goals.
Love it, man. So yeah, that's what I really like about your channel as well. You really dive deep into the topics, and you really have a way of simplifying them as well. So, which is very rare because with the things that you're talking about, it's tricky.
Yeah, it's not bicep curls and tricep extensions. It can get kind of deep, but it's important. I think we should know this.
Right. And that's actually a message I'm trying to start preaching on my channel as I get more knowledge regarding certain topics that is so much deeper than muscles. There's so much stuff that's neurological, physiological, and people rarely talk about, for example, like your eyes, your teeth, and other factors that we're going to be covering today. Well, Zac will be. So first things first, let's talk about more general stuff. Like, what drives you to be a coach? What drives you to help people out? Because I was talking about this with Connor not too long ago, how a lot of what you see on Instagram, YouTube, it's very ego-driven. It's very easy to fall into that trap where it's me, 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 me. And a lot of people, I've been noticing this as well. And who knows, maybe I've done this in the past as well, where it's more so about showing off and getting more views than the next guy or the next woman. And how do you not fall into that trap? How do you kind of take your ego and put it out of the way and really, I know it has to do with who you are in general and the person that you are that's what you're gonna bring to the platform, obviously. But what drives you to be a coach? What drives you to help people out?
Yeah, I think with a lot of this stuff, especially early on in my career, I think in some respects it was ego driven. But it's like there were things that I struggled with from a movement standpoint, from just a personal standpoint, and going through that process of trying to improve my own movement and health and all of that, I found it to be really impactful, and I wanted to be able to share that with other people and help guide other people through that process. And I'll readily admit this, early on in my career, I think there was a little bit of, not that I wanted to be better than other people, but there were some inadequacies that I saw within myself that I wanted to try to make up for by being really good at my job. And as I did get better at my craft, the head gets a little bit big. And it really, probably the most impactful thing that ever happened to me professionally was getting fired from my NBA job, because it was that moment when I realized that I was the problem. And that really created a big shift in my perspective of why I'm doing what I'm doing. And I think it also was a catalyst of I need to make things even simpler, because early on in my career, man, I was getting super fancy with a lot of this stuff. I was getting into, we'll talk about this because I think it still matters, but I was getting into teeth. I was getting into vision. I was getting into, doing the most fancy esoteric exercise out there to get this one movement adaptation. And what I found was, by doing that, it wasn't about helping that person, because what that person needed was the basics. It was about feeding the ego, because I knew this stuff, and it wasn't that I was educating it in a manner to say that, but that's what it ended up becoming. But once I got my ego squashed and I was able to take myself out of the equation, I was able to re-simplify the movement model that I utilize now, and help other people, I guess, better reach people at where they were at, as opposed to showing what I know. So what drives me now is I think that there's a lot of information out there. I've I've taken a lot of seminars. I've learned a lot. I've wasted a lot of time and money too. And I want to help people along that process. I've been fortunate to have a lot of good mentors in my life. And I think the key with mentorship is you're essentially taking that person's experiences, that person's trial and error that they went through, and it's helping expedite the process so you don't have to make those same mistakes. And what I want to teach people is I want them to learn from my mistakes. So I save them time, so I save them effort, so I save them energy, so they can focus what they want to focus on, that's going to help their clients achieve the outcomes. And that's really what it's about. Like, once I was able to separate it from not being about me, and it's about really helping the people that we work with, that has made all the difference. And I think one reason that I'm driven to teach is because I can only help so many people in a given day, in a given week, with one-on-one consults and things like that. But Phil, if I can teach you to better help your clientele, then I've helped that many more people. And to me, that's more rewarding. To me, that's how I that's my purpose. That's what drives me to making the industry a better place, is helping people learn complex topics in a simple manner, and then getting them to be able to execute from that.
I like it. So let's get into it, man.
Let's get nuts.
So you're talking about helping people move better, which has a lot to do with posture. A lot of, strength and conditioning coaches have different ways of describing posture in multitude of different ways. So just keep it simple for today's episode. How would you describe good posture, ideal posture for someone?
The best posture is one that is constantly changing and is able to adapt and morph. There's nothing wrong with sitting in a slouched position, but it becomes wrong if that's your only option available. There's nothing wrong with sitting chest proud, upright, all this stuff, because mama said sit up straight. But that becomes a problem if that's the only option you have available. So posture becomes an issue when we don't have the ability to change, to morph and adapt. So what I focus on a lot with my clients and the people who I work with and the people who I teach is restoring what I would call all of one's movement options. What I mean by that is there's certain physiological normals that we should be able to express within our body. For example, at the hip joint, depending on who you read, you should have about 60 degrees of hip external rotation. You should have about 40 degrees of internal rotation. If you don't have that, you should probably do things to get that. If you have more than that, you should probably do things to reduce that. And that's really what it's about. It's about restoring those physiological norms and then being able to express the movements that you want to express and ought to be able to express with the best technique for your given structure. Phil, you're built a little bit differently than I am, although you have an amazing haircut. I just have to say that. We are similar in that regard, and I appreciate that. So your
Long hair,
squat,
don't care.
boom, yep. Although, man, it's too bad that we didn't do this when I had the beard, because then it would be like, some mirroring that we'd have going on there. But your squat's going to look different than my squat based on the way we're built. But there should be certain qualities of a squat that both of us should possess that make it a squat and don't make it a hinge. And that's, to me, what good posture is the ability to change, adapt, morph, and express your movement options within your body.
Right. No, I like that answer. It's one that doesn't lack variability.
Yeah.
People have this idea that good posture is just like stand up straight. That's it. Poke your chest out or whatever. Like, it's like that's not posture at all. Like, look at athletes and being able to go in different directions and not being stuck in one orientation.
Yeah.
So I like that answer.
Yeah.
Rigidity. It's not a static position.
Yes, absolutely. When you're static, that's when things become problematic. Ooh, that rhymed. I didn't even intend for that to happen. Think of it this way. It's like, if you look at something like heart rate variability, generally having a more variable heart rate, or like having changes in that R to R interval that are substantial is favorable from a health standpoint. And when you lack that variability, then it becomes problematic from a health perspective.
Right.
It's when you can't change that things become an issue.
Right. And it goes into our whole survival, being able to adapt. That's how we made it so far as a species. But so let's dive into the ZOA, the zone of apposition. What is it and why should people care? Should they even care?
Yeah, that's actually a good question. So I think there's a lot of misinformation about this. The zone there's a researcher called Andre DeTroyer. He's like basically like the Michael Jordan of all things breathing research. And in some of his papers, he discusses the zone of apposition. And really all that is it's the amount of diaphragm tissue that is adjacent or next to the rib cage. So I'll give you an example. You always have a zone of apposition, but the degree of zone of apposition is going to change based on a multitude of factors. So for example, if you complete a full exhalation, you get as much air out as humanly possible, you're going to have a larger ZOA, or zone of apposition, than you would if you take the largest inhalation that you possibly can achieve. And the reason why that is because when I exhale, the diaphragm ascends, and more of the diaphragm tissue is laying next to the rib cage. When you inhale, the diaphragm descends and it flattens, and less of the diaphragm tissue is going to be up against the rib cage. So when we talk about having a poor zone of apposition, what that means is that less diaphragmatic tissue is up against the rib cage at any one given point. And when I would argue that it's problematic is because there's nothing wrong with being able to exhale or inhale. It goes back to the discussion we had with posture. It's when you have fewer options available in terms of your ability to change your zone of apposition. So in many of the compensatory situations that we see, there is a reduction of excursion of the diaphragm. Subsequently, a reduction of excursion or movement capabilities within the rib cage. There was, I can't remember what the study was, but I know I talked about it in a talk that's available on my newsletter, where you can have changes in the resting position of your diaphragm within 4 to 6 weeks, depending on various circumstances. There's also some structural changes that can happen that might make you bias towards having more or less of a zone of apposition. And that's basically what it is, though. Is in a perfect world, we ideally want to be able to have the capability of achieving a increased and decreased zone of apposition, but due to a multitude of factors, many individuals, especially when there is a reduction of one's ability to move, have a reduced amount of a zone of apposition.
Right. So it's kind of like the variability, like the last question.
Yeah, it's the same thing. It's just like you can have a certain amount of range of motion in your elbow, or you can lack range of motion in your elbow. Same thing happens in the rib cage. You can have a certain amount of range of motion available in the rib cage, or you cannot. And the goal would be to restore that range of motion that should be physiologically available within your body.
Mm-hmm. So speaking on that, let's talk about the infrasternal angle. It's been a pretty hot topic lately. What are your thoughts on it? What should people care? What is it?
Yeah, it's probably been one of the most impactful measures over the last few years. I have to give a shout out to Bill Hartman for exposing me to it as a measure that we look at. So basically what the infrasternal angle is if you look at your xiphoid process, which is the rubbery part of your sternum. So if you touch your sternum or your breastbone and you move down, it starts to get a little bit of bounce to it. That's your xiphoid process. What you're going to do is you're going to dip below that and measure the medial margins of the lower rib cage, aka the inside part of the rib cage. So it's going to be this little V right below that. You don't want to go on the underside of the rib cage, but it's like right below the xiphoid process. So because and the key with measuring is you don't want to go too high because the angle is going to be really narrow. If you go too low on the bottom of the rib cage, the angle is going to be wide. So we want that middle ground.
A sweet spot, yeah.
Yep. I think it's an important measure because it gives you an appreciation for two things. One, it gives you an appreciation for a person's body structure. As I had mentioned before, Phil, you and I are built differently, so we're going to move differently, and we're going to be biased towards certain compensations based on our structure, and we can't ignore that. You're a strong guy, right? Because you do powerlifting, bodybuilding?
Just a recreational lifter.
Really? Man, good for you. But you can probably move a decent amount of weight, I'm assuming. Just, having watched you a little bit. I watched your YouTube channel a little bit before hopping in on this.
Yeah.
Yeah, you would probably move more weight than I can. But I bet I'm a better runner than you because that was my sport.
Oh, for sure.
Yeah, so you and I, based on our body structure, are going to have biases in terms of what we're good at and also what we're not good at. Same thing from a movement perspective. So I think the infrasternal angle is important to measure that because it can give us some insight in terms of what potential biases we may have. Two, I also think it's important to measure because we can appreciate what physiological motion we can or should have available in the lower rib cage. Just like we might measure range of motion at a hip or a shoulder, we can look at range of motion availability in the rib cage as well. There's a movement called the bucket handle action of the rib cage. Basically what that is when you take a breath of air in, your ribs should move outward and upward during the inhalation, and they should move downward and inward during the exhalation. If you can't do that, then you have a loss of movement options within the rib cage. You can look at the infrasternal angle and see what one's bias is. Someone might be more biased towards an exhalation-based strategy or an inhalation-based strategy. And if that person has the movement capabilities to be able to go into both an inhalation and an exhalation-based position. And if you lack those things, then we can have some insights in terms of what potential strategies we could use to improve your movement capabilities in that area.
Right. So from the conversation we had in the DMs, You were talking about the stack. So you mind elaborating on that?
So with compensatory mechanics, I have a loss of movement options. Generally, what happens with people is due to the effects of gravity, due to us having a certain amount of air within us at all times. That's what's called the dead space in the lungs. There's going to be a bias of having a descended diaphragm. That's normal. And when that diaphragm is descended and it can't fully ascend, there's going to be a restriction of movement options. And generally what happens is if, depending on the degree that the diaphragm descends, that's going to change the relative orientation of the pelvis. So I actually have, hang on, let me see if I can find them. I actually have a handy dandy thing that I can demonstrate on this to illustrate this concept. There's one, and you can use tubes or syringes, that I use for my steroids that I don't take. Yeah, well, crud. Can't find the other one. Go figure. But we got this syringe here, right? So I want you to think of this syringe as the shape of your body. If I'm looking at, like, this would be a wider syringe, okay? And let's say the plunger is the diaphragm. And then this would be your pelvic floor, the bottom part of the syringe, okay? If I impact, or if I create a force of gravity on this plunger, diaphragm is going to move downward a certain amount, okay? If I could find my narrower tube, the narrower tube would actually descend a bit further, okay? Now, Phil, I'm going to ask you a question. If I'm pushing downward, okay, and let's say this is the plunger's the diaphragm, as I push downward, what am I moving in this open spot on the plunger? What is being pushed downward?
The infrastructure triangle?
No. So think about what's within your body. Right? So your diaphragm is above or below the lungs, but what is below the diaphragm within your body? And it doesn't have to be anything specific, but there's a bunch of stuff there. So what's above the pelvis? What's the stuff in between those, the pelvis and the diaphragm?
Putting me on the spot.
I do apologize, but
no, I don't care.
Yeah. If I were to punch you in the stomach right now, what would you be concerned about? What would you want to protect?
I don't know, man. Tell me.
Your stomach, your guts, your intestines, all that stuff.
Yeah, for sure. Yeah.
Yeah, right. So as the diaphragm descends, what's happening is it's pushing the guts downward. Okay. So with a wider tube, there is less downward push of the guts than a narrower tube. Okay. And it has to do with the structure of the tube. So based on that, when I have guts that are being pushed downward, there has to be a certain amount of surface area in the pelvis to be able to catch or accept the viscera moving downward, right?
Mm-hmm.
You want to think of it, this is really what the piston thing is that someone talks about, like creating a canister effect. This is an intra-abdominal pressure. This is what it's about, okay? So if I don't push my tube too far down, or my diaphragm too far down, and the viscera only moves downward a little bit, I don't need as much surface area on the pelvis. So what happens in this case is the pelvis is going to be more relatively forward, because that's really just the resting bias that we all have within our pelvis. There's actually a good article by Weisel in 1955, where the standing position, they looked at what direction the pelvis is tilted or moved, and it's more anterior. Okay. So the further the diaphragm descends, then I need to do something to be able to accept the guts that are moving downward. And so what happens in that case, is the top of the pelvis, what we would call the pelvic inlet, is going to spread apart and open up. And that's to catch all this stuff that's moving downward. The guts, yes, sir. So when that happens, the pelvis actually has to tip posteriorly in order to make that happen. Okay? And when you have either of those situations, when the diaphragm descends and it can't fully ascend, essentially what happens is you have a disruption of normal respiratory mechanics. AKA, I have this downward pressure occurring at all times, and I lack the ability to reverse that relationship. So descended diaphragm, I have a change in the orientation of the pelvis. The first line of defense in terms of restoring movement options is achieving a stacked position. And all that a stacked position is being able to place the pelvic floor or the pelvic diaphragm and the thoracic diaphragm atop one another, which would be a fully exhaled position. Or as we talked about with the zone of apposition, being able to maximize the amount of diaphragm tissue, thoracic diaphragm tissue up against the rib cage. So what I have to do in that case is I have to be able to create some semblance of a posterior tilt, aka being able to tuck your hips.
Right.
That's how I create the bottom part of the stack. And then the top part of the stack is being able to achieve a full, complete exhalation without compensation. So getting as much air out as you can without using too much superficial musculature. That's going to create an ascended position of the diaphragm. When I have the issue before where I have the diaphragm descended and the guts pushing downward, I don't have that thoracic diaphragm atop the pelvic floor relationship. I have an alteration in that. So all the stack is achieving that stacked position or that normal relationship. And if you lack the ability to do that, it doesn't matter what crazy exercises you can do or what you do up in the craniocervical region. That's going to be the first line of defense that we have for people. And, most of the time, if you have any compensations that you see within your movement, so you hinge too much when you squat, or you have this huge arch in your back when you do a deadlift, or when you do an overhead press and you shoot your head way forward. Many times, those compensations that we see can be improved by achieving that stacked position. And to me, I spend a bulk of my coaching focusing on getting people to do that in as many different situations as possible.
Right. No, thanks for that answer, man. It's answer my question for sure.
Good.
So let's talk about the natural asymmetries of the body and why is unilateral work and alternating lifts, why are they so important?
Yeah, so we do have an asymmetry within us. You have a heart on your left, you have a liver on your right, you have an asymmetrical twist and rotation of the guts. And based on those asymmetries and how we interact with gravity, there's always this counterclockwise force that we're fighting against. And if you ever get a chance to have Bill Hartman on here, he can probably go a little bit more in depth than I can. But because of that counterclockwise force that we're fighting against, we will oftentimes bias our right side to mitigate that force. Okay, so I don't want to fall left, so I'm going to shove myself as far as I can right to counteract that. There's some good articles within the Spine Journal that were done, I think, in like 2006 to 2008, somewhere around there, that looked at this right-sided bias. And based on the internal organ anatomy, there is a rightward rotation throughout the spine. That's normal. Normal rightward scoliosis that is present within all of us. And they base this off of the viscera or the guts in the internal organs, because they also looked at people who had organ flip-flop, which we call situs inversus totalis. So you got a heart on your right, liver on your left, and it's the opposite direction. So we're constantly having to battle this asymmetry. And a lot of times doing unilateral work to mitigate that can be useful. But what I've found practically is early on in my career, I did a lot of the asymmetrical work, doing shifting on one side, getting, one muscle on the other side. And I got some good results for sure. But with the people who I didn't get good results with, I felt as though that we were skipping steps and I was skipping steps. And what I focused on more recently now is focusing on getting that stacked position. Because if you don't have that first and you try to do something that's more of a unilateral bias, you are likely going to compensate because it's harder. So I'll give you an example. Let's say we're doing a hip shift exercise. That's a common exercise that you'll see that's asymmetrical. And for those who don't know what that is, it would be a situation where you would be pulling one hip backwards and the other hip would be going forwards. Common times you would see this you could do this in a split squat, for example, to where you're trying to put more weight onto the front leg. You might think about, if my left leg was in front, I would be shooting my zipper on my pants to the left.
Right. Or like a single leg RDL or something.
Or like a single leg RDL. Yeah, great example. Great example. There's a certain amount of rotation that's happening at the pelvis to make that happen. But in order to create that rotation, there's a certain thing I have to do on the left side of my pelvis versus my right. When I do something bilaterally and I focus on the stack, that encourages the certain action that we're trying to do on one side on both sides. So it's easier, right? It's easier to do something on two legs than it is on one leg. And sometimes if you go to the one-legged version first, you're more likely to fall into a compensatory strategy because it's harder. What I found is emphasizing more bilateral work, believe it or not, and getting that stacked position has minimized the amount of times that I've had to go with a unilateral or asymmetrical exercise to get the same outcome that I wanted before. And I have this joke on my Movement Debrief, my show, that if you can't stack, don't talk to Zac. So I actually, God, no, man, I'm corny as hell, man, but people like it.
The corny jokes are the funniest, man.
Yeah, I know. I tell you, if I ever become a dad, my kids are going to it's going to be 18 years of hell because it's going to be all dad jokes. But
no, but it's true. If you can't stack, if someone just can't stack and they're just doing these unilateral lifts without understanding the basic concept you just spoke about, they're just an unstacked individual doing a unilateral lift.
Yeah, and then they wonder why it doesn't work. Well, it's like you're trying to play Elton John on the piano before you can play chopsticks.
I get it, yeah.
Right.
And you're saying that when you do bilateral, you get this like sagittal plane competency. It's a bit easier to teach a person to get that PPT on both sides, supposed to kind of like shifting and teaching. So I understand what you mean.
Yeah, absolutely. And a lot of times what you'll see is some of the asymmetries you might find in movement or testing. A lot of times it clears up if you can have that concept. Like a common example actually is, you've seen shifting in a squat, right? Where someone loads one leg too much or they have this rotational action occurring about the pelvis. Well, a lot of times what happens in that case is that person may just have an inability to keep that stacked position when they hit those certain depths in a squat. And you could do something that's asymmetrical, but I've also gotten good results by focusing on drilling that, having that person drill, keeping the stacked position within those ranges. And a lot of times that does clear up those shifts. So you have to be able to have that stack capability first before you get too wild and crazy going asymmetrical. And a lot of times, if you can get the stack, your asymmetrical work is going to go that much better. So I implore people to emphasize that first.
Right. Makes sense. To try to maintain the stack throughout the range of motion on like some of these big lifts.
Yeah, on really just about any lift. I mean, the only lift where I would say is disadvantageous would be if you're trying to move maximal load in something like a bench press. Probably going to be pretty tough if you're, doing your 1RM and your squats, your deadlifts, or any of your Olympic lifts. But if you look at some of the elites, they don't have to do these crazy arches or things like that to move mega weight. You look at like, I think his name is, this is like a fairly famous Olympic weightlifter in China, Lu, I think his name. I forget what his last name is.
Xian or something.
Lu Xian, yeah. If you watch him when he does his snatch and just how fast he gets into the bottom and how upright he is, it's remarkable. Like, to me, that is a great ability of stacking under load. Now, when he's pushing the weight up, of course, he loses that position. But because he can start in a good bottom position, it allows him to be able to just push out of the bottom that much easier.
Right. Okay, well, the fact of the matter is that a lot of people aren't in the stacked position that we're talking about. And from the clients I've worked with, from myself is getting better, obviously, but a lot of people tend to be living in extension and they can't get out of it. And, you see like their feet are flared out. Everything's kind of like out, forward, and up. Traps are like this. Everything's just... What's the question? I'm losing my... I haven't eaten today.
Great.
Yeah.
You're about that IF game? That intermittent fasting?
No.
Oh, okay.
I actually did eat, but I haven't had lunch. But it doesn't matter. So what are some strategies that you use to get people to get their center of mass back? Because I noticed you talk a lot about posterior ribcage expansion, and you made a video on the reverse sled drag. So what are some strategies you'll use with an individual who tends to live in extension and you want to get their weight shifted more back? You want to get them feeling their heels more, stuff of that nature.
Yeah. So if I have someone who can't flex, or they lack that capability, which, believe it or not, there are some people who can't extend either. And this goes into a little bit of those two different infrasternal angle presentations that we touched on briefly, because someone can have a wide versus a narrow. Like, for example, a wide infrasternal angle, they're going to have a greater predisposition of having that extension bias. And it doesn't mean that they're good at it, but that's their relative bias. Whereas someone who's narrow will actually have more of a flexion bias. So in those two populations, wides, in theory, should be better at hinging, but they might not be as good at squatting. Because really, when we're talking about feeling heels and getting posterior expansion and things of that nature, that's to achieve a full squat. Whereas narrows ought to, not always, ought to be better at squatting, but they might not be as good at hinging. So although there can be secondary compensations on top of that might make someone more biased towards the extension side of things, it's not always cut and dry that everyone is biased towards extension. But let's just say we have someone who is more biased towards extension, or we could look at it this way too. They can't create expansion in the backside of their body, or they can't stretch or eccentrically elongate tissues on the backside of their body. Stack is always the first priority. That's usually what I go with first, because that at least gives that person the potential to create that posterior expansion. And then from there, we have to look at how can we pre-position the body to ensure or encourage that that person can get that expansion or stretchability into the backside, or if we can get them to flex. For me, it starts, the way I like to think of it is building a skyscraper. right? If you wanted to build a skyscraper, the first thing you have to do is build a foundation, and then you can add stories to the skyscraper, so to speak. The foundation, when we're talking about this from a movement perspective, is being able to restore the movement capabilities in the pelvis. So if I wanted to create flexion within the body, I need to be able to maximally create a posterior pelvic tilt. The way that I would do that would be maximizing one's ability to achieve hip flexion. AKA, can they bring their knee to their chest, or can they achieve a full squat? And when I look at a squat, I'm not talking a back squat or a powerlifting squat. I'm talking vertical, up and down pelvic movement, crapping in the woods kind of thing.
Right.
Right. So if you actually, a great example of this, if you go to Google Images and you search Aborigine squat, and you
Yeah, I
just
get
look
it. Yeah,
at
I know
how
what you
that,
mean. Yeah.
yeah,
ATG,
yeah,
like.
ATG with roundedness throughout the spine. That's your
Right.
terminal move. So I will do a lot of things that emphasize that posterior pelvic tilt. There's a drill I like called a drunken turtle. That's really good for achieving that, actually achieving the flexed posture throughout the spine, where you bring your knees to your chest and you roll backwards and forwards as much as possible.
Yeah,
That's
I
a
saw.
great move.
Yeah.
Yeah, yeah. Give it a shot.
There's another one.
Um,
I saw the one with the curl, the rounded back curl. Yeah.
yes. Yeah. Yeah.
Couple
Anything
ones.
like that is good. Um, Other ways that you would get the expansion, if we're talking more like the upper thorax or pushing the rib cage backwards, I like reaching at 0 to 60 degrees of shoulder flexion, either reaching low or I like reaching high. And the reason why that is because of the way that the scapula is moving up against the rib cage. The inner border is going to be further away from the rib cage, meaning that stuff in your upper back is going to be more on stretch. If stuff in your upper back is more on stretch, you can push more air back there. And if you can push more air back there, you're going to have a more flexed position within the rib cage. So that's where, why is that sled drag that we talked about so useful? Well, it's useful because I can get tucked. I have a counterweight in front of me that allows me to sit back and feel my heels, which can allow me to get in more of a flexed position. But the other cool thing, Phil, about that is your shoulders are at about, 45, 60 degrees of shoulder flexion. That's going to allow for me to get a nice stretch in my upper back and get expansion back there.
Right. Right.
Right. Now, so I'm going to use those types of strategies to get that flexed position. So anything that you can do that reaches low or reaches high and get the tuck position and drive progressive hip flexion, those are money makers. One issue that I see a lot of people do when they reach, or maybe you do something in quadruped to try to get, the rib cage to move backwards, is they'll reach, but then they'll crunch, they'll bend at the sternum and they'll flex a lot. And they think, wow, this creates this nice, huge flexion in the rib cage. I must be getting it right. False. What's happening in that case is you're using your rectus abdominis to create this
Crunch.
huge flexion crunch posture. And what inevitably happens is you only really get flexion in the spine at a few segments. And when I crunch forward, I lack the ability to get the expansion in the uppermost parts of the thorax. What I'm shooting for when I try to get someone out of a more extended posture is I want uniform flexion to occur in the spine. And so anytime you're doing any reaching activity, if it's reaching low, if it's reaching high, or you're in quadruped and you're trying to get expansion that way, you need to make sure that you're not getting any bending at the sternum or crunching in order to make that happen. So
you want to stay tall. You want to stay
you
tall.
Want to stay tall.
Right.
You want to stay tall. Or like the way I like it is like if I'm reaching and I'm upright, my chest is parallel to the wall and it doesn't bend. If I'm in quadruped or quadruped on elbows, those are some good positions I like to use. My chest doesn't bend; it stays parallel to the floor.
Nice. I know you've mentioned a lot of this in your videos as well, and I've watched a lot of your videos, but just for the sake of this Q&A, most of the audience probably hasn't. So let's talk about shruggy reaching. We know that reaching is important. We know that serratus and all that kind of stuff. Shifting our weight back. So people know that, and they'll try to apply it to, landmine presses, medals rows, different forms of presses and pulls, push-ups. But what you'll end up seeing a lot of time is they'll shrug it, and it kind of defeats the purpose. So how would you go about coaching somebody, or like cueing them to for that not to not happen?
Instead of the thug life, they chose the shrug life. Never good. Which, yeah, as a hip hop head, man, you know how I feel about that. So interesting thing. The fix in my eyes to eliminate the shrugging when you're reaching is actually the same fix that we just talked about, because really the person who's shrugging when they reach is doing the same crunching compensation. So I'll have you try this, Phil. Go ahead and reach your arm forward, but keep your chest parallel. And I want you to go ahead and put your hand on your trap on the side that's reaching. Okay, so you're going to feel a certain amount of tension there. That's normal. Now I want you to just slouch as much as possible and crunch and feel a change, but keep your arm in the same position. All right, do you feel the change in tension when you do that?
Yeah.
Yeah. So what happened in that case? Well, when you crunched yourself during your reach, you increased the bias or the line of pull that your upper trapezius has when performing the action. So I see someone shrugging as they reach. I'm thinking that that person, even if it's not visually the case, is likely crunching, or as I would call, they're downing the pump handle, or they're bending the sternum down. So many times what I will do to improve that is I'll put them in positions, or I'll choose exercises, or I'll cue my clients to keep the chest parallel when they're performing a reach. So I'm trying to think of a common example of this, but like, say you're doing a dumbbell row, right? One arm on the bench and things like that, and you see that shrug happening. A lot of times what's going on is the issue is because when they're supporting themselves with the opposite hand, they're having to bend at the rib cage in order to hold themselves upright. So what you might do is you could think about elevating the bench, so it makes it like maybe putting it on an incline, so it makes it a little bit easier to reach and then pull from that position, or doing a chest supported version. And a lot of times that will fix the shrug. If they're keeping the chest parallel and you still notice some shrugging, I'll simply cue a down shrug. And the way that I cue that is I'll tell the person, hey, I want you to shrug your shoulders up as high as you possibly can. So feel the compensation that they're doing. I don't know. And then I'll have them go the opposite way. And then I'll say, hey, do the opposite of that. And a lot of times that's enough to get them to mitigate the shrug. So make sure you're keeping the chest parallel. You're not bending at the chest. And then down shrug if that doesn't fix it.
Got you. So speaking of reaching, let's just talk about some overhead stuff. Because you see a lot of like overhead presses online. I love the overhead press. Building bigger delts.
Absolutely.
Who doesn't like it? Looks badass.
Yeah.
It's athletic.
Not when I do it. Not when I do it, but I feel badass when I do it.
But you see a lot of people online, like we talked about earlier in the talk. A lot of people are stuck in extension and they can't get out of it. So they lack variability, and everything it's like what we keep saying, keeps going forward. And Tony Gentlecore made a great article saying you have to earn your right to overhead press. And you talk about certain requirements. People are going to read that and they're going to be like, oh, who are you to tell me I can't overhead press? I'm going to put these weights over my head. And they basically turn it to a standing incline press. If we're talking about the barbell standing press. So how does it work with overhead pressing with you? Like what's like the checklist of like, who should flat out not be overhead pressing? Or who would be wise to not overhead press? And I know that if we're talking about, strongman competitors is different. They have to overhead press. But if we're talking about, recreational lifters, people who are lifting not for trophy, not for titles, they want to feel healthy, but they want to be able to put weights over their head.
Yeah, that's a great question. So I think the two most important things would be broken record, but do you have the ability to stack? Because if I can't maintain that thoracic diaphragm atop the pelvic diaphragm relationship, well, guess what? Why would one reason be that you have to arch backwards? Or what is arching backwards? But really all that is it's reinforcing the unstacked position as you press overhead. So as we talked about before, right, if you're going to build a skyscraper, you need to have the foundation first, and being able to achieve the stack is that foundation. So then now let's talk about what is the rest of the thing, the foundation, or what are the stories that I have to build in order to have that maximal skyscraper? Because in order for me to go fully overhead, there's a certain amount of motion that I need at the shoulder in a few different directions, and I also have to be able to do certain things at the scapula. So full shoulder flexion or elevation predominantly occurs by having external rotation at the humerus, high five position, right?
Right.
And it's usually about 60 degrees in that flexed position. And then I have to have scapular upward rotation. In order to have both of those things occur, I need to be able to create a certain amount of expansion in the thorax. AKA, I need to be able to have mobility in the uppermost parts of the thorax, well, actually the entire thoracic spine. So I should be able to expand and stretch in the mid to lower thorax, and I should be able to expand and stretch into the uppermost segments. That's needed to be able to complete upward rotation, have enough humeral external rotation to complete the lift. So usually what I test is, can someone stack? And then how much shoulder flexion, true shoulder flexion, do they possess? And the way I test it is I force the humerus into a little bit of external rotation. I'll drive forearm supination to bias that even further. And then I'll see if they can get true shoulder flexion without deviating out of that plane, out of the sagittal plane.
Is this on a table?
This is on a table.
Okay.
Yeah, but if you don't have that capability, you could do it on the floor as well. So like, I can't demo it on the floor, but if you could envision seeing me right now, I'm on the floor with my knees bent. I got my fingertips on the ground, and I'm going to slide my hand upward without arching my back, shooting my elbow out, or having my hand drift inward towards my head. And what you're looking for in that position is you want to get the arm as close to the ear as possible without those compensations. So if you can't do that, going to a bilateral overhead press is probably not a good idea. But however, I think if you can get close to that, and we'll say maybe you're an arm's length away from your ear, you could totally use overhead pressing to finish and attain the rest of that range of motion, assuming you can stack. But the versions that I like to teach would be unilateral, and I also like an Arnold press. Like, man, Arnold was on some shit. Because one, he was elevating his heels when he squatted, which is a great way to coach the squat. But two, when he was doing his seated press, depending on the amount of hip flexion you drive, that can actually encourage you to get the bottom part of the stack or get a posterior tilt in the pelvis, which would allow you to have the foundation to be able to press overhead. So doing an Arnold press, but doing it unilaterally, can be a great way to restore shoulder flexion. And if you can't do that, if you struggle maintaining a stacked position, or you can't get the amount of shoulder flexion you need to make it a worthwhile lift, I'm a huge fan of utilizing either landmine pressing to grade yourself up to that position, or incline pressing. And generally, you're going to maximize your movement capabilities if you can do them asymmetrical or unilaterally. So
Right.
Yeah, because anytime you go ahead.
Yeah, you're saying when he was doing the Arnold press, because a lot of people they turn it to an incline. They do their overhead press, but you're saying that Arnold, when you have the dumbbells in front of you, you're less likely to lean back. And if you add the alternation component, get some oblique in there. I know what you mean.
Yeah. Well, oblique, and then two, if I can create a little side bend with it, I actually will get some lateral expansion.
A little hike, yeah,
which is needed to be able to go overhead. And two, if you have the bench incline, so the bench is up against your back, it minimizes your ability to compensate. And I would milk those variations as long as possible. And if you can do those and you're not compensating, and eventually you can do bilateral versions and you're not compensating, then you're probably ready to go with an overhead press.
Nice. So while we're on the topic of, overhead lifting, getting the arms overhead, let's talk about assessing. So without getting too much in the crazy details, you see someone day one. First off, do you even assess? That's a question, but
Yes, very much so.
what are some like overhead squats, or like what are some ways that you'll assess a client like the first time you see them, just to see what their limitations are?
Yeah, that's a good question. So to get a gross appreciation for someone's ability or inability to move, and this is more for the client than it is me, but I'll look at like a toe touch, I'll look at a squat, and we're talking like the ass to grass Aborigine style squat, not like, wide stance power lifter. Those can give me a lot of insights in terms of what movement strategies a person may or may not be using. For example, when I touch my toes, my pelvis has to dump forward, right? So it folds over as I go into the toe touch position. When I can get in that full squat, the pelvis has to go backwards, because that's what allows for the vertical displacement of the pelvis to occur. So I like both of those moves as a gross test. Um, Otherwise, my big decision makers are a knee to chest. So can you bring your knee up to your chest one at a time without having it deviate outward or inward or getting pinching in the front of your hip? That's a great way to see if someone has passive capabilities of getting that posterior tilt on the knee to chest side. And then I also like it because if you can keep the down leg straight on the ground, it gives you an appreciation for hip extension, which is needed for deadlifting. It's needed for, any finish where you're finishing tall, sprinting, things of that nature. So it's a great way to get an appreciation for someone's movement capabilities at the pelvis. The other test that I think would be useful would be doing shoulder flexion the way that I looked at it, because that can give you a great appreciation for what type of press variation someone cannot do. And there's a few other tests that I look at. I mean, I look at just about every measure, in person and then remote. I look at a few other things, but like those couple tests are some of my big decision makers when we're talking about exercise prescription, both from improving movement options and also what menu I can choose from to help someone elicit some training adaptations with minimal cost.
Right. So you made a video, and this one I actually didn't watch because I decided to ask in this Q&A.
Love it.
You talked about how six packs can affect movement, and I remember Pat Davidson mentioned something similar to this. So you mind just elaborating on that?
Yeah. So having a well-developed six-pack, and really it's if the resting tension in my rectus abdominis is biased more towards being concentric or short. Maybe the audience, I don't know if your audience talks like in terms of short versus long or stiff, tensed.
Right.
What that's going to do is two things. In the upper body, it's going to, because your rectus abdominis or your six-pack muscle pulls the sternum, attaches at the lower part of the sternum, it's going to pull the sternum down if it's biased towards being shorter or tense. And if I'm in that position, think about all the compensations that we talked about that could be manifested by that, right? You might be choosing the shrug life instead of the thug life. You might have difficulty completing any type of pushing or pulling. You might have more neck tension. So it could restrict your movement capabilities in the upper part of the body. At the pelvis, it attaches at the top part of the front of the pelvis. So it's not a very good posterior tilter of the pelvis. A lot of times what happens is if I'm bending the sternum and I'm contracting the rectus abdominis, what this will often do based on the thorax being too far forward is it'll actually shove the pelvis forward, or it'll translate it forward. So you have this situation where the thorax is backwards and the pelvis is forwards, which would be a loss of a stacked position. So what that's going to do is that's going to negatively influence movement. You're not going to be, when someone squats, they might shoot the pelvis way far forward and the thorax will tilt backwards. That could put a little more stress and strain on the knees. It might make someone have a difficult time hinging because they have this much more excursion needed to shoot the hips back. It could be a lot of different compensations. So is it bad to have a six-pack? No, but if you lack the options, if you lack the movement options, like if you can't get into the stacked position, if you can't reach fully overhead, you might need to do activities to be able to get those tissues to stretch, elongate, or relax. And in my mind, that's what it's about. And so how are some ways that you could do that? Mastering quadruped, being on hands and knees, and doing a lot of movements from that position is really useful. And the reason why that is because when you're in quadruped, you have gravity pushing downward. And as we had talked about earlier in this talk, the guts, they move. So if gravity is pushing downward, it's actually going to push the guts into the front part of the ab wall, which is going to create a passive stretch of things on the front side of the ab wall, which would be your six-pack muscles. So utilizing quadruped can be really useful for a lot of people to get that muscle to chill and relax. And then you could do various reaching activities or, anything really in that position. The world is your oyster. Go shuck yourself, if you know what I'm saying.
But because people could also make the argument that the abs and the hamstrings, they help tuck. You get what I'm saying?
Mm-hmm. They absolutely do. But here's the issue.
So what are the movements, the six-pack movements that however you want to call it, that are contributing to this problem?
Yeah, so the issues would be if I'm using rectus abdominis as my predominant posterior tilter. So muscles pull from, both of their attachment points. I'm going to have a subsequent bending at the upper part of the thorax. I'm going to have that crunched position, which, as we talked about, is going to be undesirable for attaining movement in the upper body. Okay. So some of your movements are going to be lost. Now, you mentioned that some people will say, well, the abs need to be engaged to create that posterior tilt. And I would actually disagree. I think the predominant posterior tilter should be your hamstrings and your glutes, glute max in particular. If I contract my obliques to encourage the posterior tilt, remember, muscles are going to pull from both attachment points. So then let's think about, what are the other attachment points of your oblique muscles? Or a lot of them are on the rib cage, which in some instances, right, I need my abs to close the rib cage so I can ascend my diaphragm. But what if my abs are engaged and it doesn't allow the normal lateral expansion that should occur during inhalation? Well, now I've essentially robbed Peter to pay Paul, right? I've used abs to be able to get the posterior tilt, but I've done so by sacrificing restoring movement options in the rib cage. So in my eyes, the posterior tilt has to occur from the glutes and hamstrings because you don't have as much of an issue with that, not necessarily the abs. And that's really what it's about. If I'm utilizing a compensatory strategy to create the movement, as Charlie Weingroff once said, there's a cost of doing business. And in that case, there's a cost of doing business. You're going to sacrifice movement elsewhere to make that happen.
Interesting. That's why it's good to do Q&As with different people, so I could get different. I could ask the same question to different coaches, and I could get completely different answers. But I'm trying to see the patterns of answers. Yeah,
and I think everyone, it's like, even though we're all approaching it from different perspectives, if we can find those common principles, then it doesn't matter what we do. In my eyes, the the principles that I hold near and dear to my heart are, I think it's important that we have all of our movement options available, both from a health perspective and a performance perspective. And then you need to do things in order to enhance and maintain your movement options with whatever activities you need to do. Like that's my life's work, and teaching people how to do that.
Okay. So a bit of a random question. Let's talk about the teeth. This is a part of the body that's not really talked about too much.
Mm-hmm.
And a part of the body I never really looked at too much either. You know, you just brush your teeth, you floss, and that's pretty much it. But you don't really understand how, most people don't understand how it affects the rest of the body. So, for example, I always chewed on my right side without really noticing it. And it's no coincidence too. It contributes to it. How I'm also really not that grounded on the left side. So, you know, watching a lot of Connor Harris, Neil Hallinan, he talks about how the molars are like the heels of the upper body. So you mind just talking about how do teeth affect posture? What if someone has like an overbite? Without getting like too much into the details, or if you want to.
Yeah, well, I can get into a little bit of a detail for sure. So your teeth are there to create some sensation within your mouth to let you know where your jaw needs to be in space. So just like I should have movement options available at my foot, because I actually like the heel analogy, molars or heels. You know, in order for me to get weight on my heels, and I need to have all of my movement options available in my ankle. Right? If you don't have that, then you need to do things to improve that. Well, same thing with teeth, right? I need to. The teeth are important for a wide variety of things. They're there for chewing and things of that nature. And when you chew, that leads to some favorable changes in tension in muscles in the cranial cervical region, and also parasympathetic activity because of the rest and digest thing. So I need to have my movement options available in my cranial cervical region to be able to elicit some of those favorable changes in tension. All right, so you should be able to have the option to chew on your right, to chew on your left, and your teeth can be sensors for that. Now, let's say you have someone who has teeth pulled on one side. Well, essentially, that's because teeth is bone. That would be like chipping away part of your heel on one side. So that's probably going to change how you move, right? So that's going to bias the resting tension that you have in your jaw musculature in your cranial cervical region. Or how about this? You mentioned like an overbite. Well, if I have a bite that doesn't allow me to have all the movement options available in my teeth contact, that's going to change the resting tension in the cervical cranial region. So teeth are very important. But what I would argue is even more important, because we have to ask, well, why does someone have an overbite? Right? Obviously, we know why people are missing teeth. Why does someone have an underbite? Why is someone a mouth breather and they're not contacting their teeth, and that leads to resting tension changes? And the answer is all the teeth are like the teeth are kind of sexy, but they're not the show. What's sexy is the upper airway positioning in your mouth. So, for example, there's some good research out there showing that the jaw position changes based on your head posture. Okay? So, for example, if I have a forward head, my jaw is going to be backwards, which would indicate someone having more of a relative overbite, or really an overjet would be the technical term. So they have the top teeth are further forward than the bottom teeth. Well, why does someone have a forward head? Well, what a forward head does is it actually opens up the airway. If you give someone CPR, go ahead and do this after this call. Give someone CPR. Hopefully someone close to you. You're going to, when you do that, you tilt the head backwards. Why do you do that? Because it opens up the oral airway so you can put air into the lungs so you could save the person's life. So let's say someone can't nasal breathe for whatever reason. You don't want to suffocate. That's kind of a goal. There's some good research out there showing if you don't breathe, you're going to die. So shooting the head forward is a compensatory measure to ensuring that you can get oxygenation. And what happens as a secondary consequence is the mandible moves backward, and that could alter where you contact on your teeth and the options you have available. So is the fix to wear a dental appliance? Maybe, but not the long-term fix in my opinion. But really the fix would be to figure out why that person is utilizing that positioning and then doing things to fix that. So maybe one example, Phil, is I could have a forward posture because I got that tight six-pack, right? And that's pulling my sternum down and my head's got to go forward. So maybe the fix is to be able to get air into the front of the chest and stretch out things there, get my rectus abdominis to chill, and that changes head positioning, which can change where you contact on your teeth. Or how about this? Maybe that person has a restriction in their tongue range of motion. Maybe they have a tongue tie, and that causes their tongue to sit down and back in the airway. And when the tongue sits back in the airway, that collapses the upper airway. Can't breathe, shoot the head forward. That was your boy. So I actually had a tongue tie surgery to try and fix that. So it can get very extensive in that regard. And on the flip side, someone who's got a military posture, that's not good either, because what happens in that case is the mandible is now too far forward in relation to the top part of your teeth, which would be the maxilla. Right? This is someone with an underbite or an underjet. Well, when I'm in that position, the upper airway is restricted. You just don't have that compensatory measure of the forward head position. So we have to ask, well, why is it that that person has that posture? Maybe they have poor development of their cranium, and maybe they need some type of dental appliance to encourage forward expansion, or in some cases you might need surgery. Now that doesn't mean that everyone who has an underbite needs surgery. I do want to be clear about that. But the point being is you probably need to have further evaluations to see why someone has these issues. And that could be, maybe it's a movement thing like I talked about before, right? The guy who has the forward head, we need to get air into the front of the chest, get the six-pack to chill, and life is hunky-dory. But maybe you need to work with a dentist or an ENT or someone else to address some issues there. And while I think that looking at orofacial stuff is useful from a movement perspective, it's a really hard sell for a lot of people, because as we talked about, I kind of went in depth, and it's like, well, I got to get a dentist so I can squat better. No. Like an error that I made early on in my career is I was doing a lot of fancy exercises. I wasn't encouraging the stack. And then I would send people to have things done to their teeth and their mouth or all that, or I was giving exercises to move the jaw this way, look this way, and all that stuff. And I wasn't getting good results. And I think a lot of people who go down that rabbit hole, they go with the fancy stuff while neglecting the basics. And I am amazed by the adaptability of us humans to be able to compensate for maybe some issues that we have in the jaw. Maybe you are missing teeth. Don't worry, it's not a death sentence. Make sure you focus on all your other stuff first. But where I think this is important is sleep quality and quantity. So if you have someone, because sometimes some of these postures are associated with something like sleep apnea or upper airway resistance syndrome. And sleep apnea, left undiagnosed, I forget what the study was, but I've read that can decrease your lifespan by 20%. It goes beyond squatting, right? It goes beyond the overhead press. It's how long can you maximize your life and well-being? And not only that, like if you have undiagnosed sleep apnea, it has several negative effects on yourself, one, but also if you sleep with someone, it has negative effects on them. Like your partner, the partner of people who have sleep apnea, have a greater predisposition of having suffering from anxiety and depression. So if your sleep is not on fleek, you might need to go get evaluated by someone to see where you're at.
Right.
And just because you don't have sleep apnea doesn't mean you're off scot-free, because there's a thing called upper airway resistance syndrome where you can have frequent wake-ups throughout the night that negatively impact your sleep quality. You never get into deep sleep, and that can also lead to some substantial problems. In fact, upper airway resistance syndrome is worse than mild sleep apnea. So if you're having trouble sleeping, you don't feel refreshed when you wake up, all of these things, you probably want to consider getting a sleep study, because you might have an issue in the upper airway. And it could be as simple as getting a sleep apnea, or a CPAP, I should say. And that can lead to a lot of profound effects. But what probably is more the long-term solution is getting things fixed up in that area. And that's why I think it's important, more so than movement.
Right. That's very interesting stuff, man.
Maybe a little bit of a tangent, but I also think, like, I think I really enjoy talking about movement and things like that. And it's like I look at all of the people on your back wall, and this is what we're doing, right? This is the goal. We want,
These guys.
yeah, we want to be big, strong, and be able to lift heavy weights. And hypertrophy has a lot of health benefits, right? Sarcopenia is a big killer for when we get older. But sleep is also really important, and I think we also have to look at how can we maximize our health and well-being. And if you're not sleeping well, you should probably do things to address that.
Yeah, we want to put all the odds in our favor.
Absolutely.
It's not just about the gym; it's also about your quality of life. And okay, so let's get into barefoot training. This is a pretty hot topic as well. You see a lot of Instagram pages on talking about the benefits of being barefoot. You see a lot of other blog posts of people saying that it's a controversial topic. And some people, it depends what kind of surface you're on too. It's a difference between being on like concrete versus sand at the beach. So, what are your thoughts on barefoot training? Because we talked a lot about variability. So that should also apply to the shoes you wear, and if you're even wearing shoes at all. And I personally think there's benefits to both. Mm-hmm. I do like some carrying variations like barefoot. I'll do like some of my accessories, barefoot. But I'm still experimenting with different stuff, But what are your thoughts on barefoot training? And just as importantly, who would be wise to avoid it for now? If we're talking about weightlifting, or even if we're talking about running.
Yeah. No, this is a great question. So with barefoot training, we have to look at two things. I think you have to take the surface into account. I think barefoot's really useful if you're on an adaptable surface. So, sand, grass, things of that nature, because your foot can contour to the surface, which is good. And you should have the ability to do things barefoot. But do we do everything barefoot? I don't think so. I think things change when you're on the gym floor, because that's not an adaptable surface. And if I look at barefoot on one end, and let's say I look at an Olympic lifting shoe on the other end, because those would be my two extremes. All right, an Olympic lifting shoe, you got a heel elevation, somewhat supportive. Both of those can be useful to drive different movement strategies throughout the body. And let me look at two different exercises to illustrate this concept. Okay, let's look at squatting, and let's look at a deadlift. We can agree that there's different mechanics in both of those movements. In theory, there should be. In my eyes, I'm defining a squat as maximal vertical displacement of the pelvis. With a deadlift, you're getting more posterior or backward displacement of a pelvis. Okay? So it's generally easier to get more vertical displacement of a pelvis when I am doing it in Olympic lifting shoes. Squatting generally looks better with Olympic lifting shoes.
Right.
Deadlifting generally looks better and feels better if you're doing it barefoot or Chuck Taylors or something like that.
Something flat.
Yeah, like no one deadlifts in Olympic lifting shoes. That's good at deadlifting. And why is that useful? Why are those shoes useful? And should we squat barefoot? Well, the answer is because the orientation of the foot changes in a manner that maximizes those extreme mechanics. There's things that happen when I posteriorly tilt the pelvis and I have more vertical displacement and I squat. There's a change in what's in the relationship of the acetabulum to the femur, your leg bone, and it's biased more towards external rotation, abduction, aka the legs are going to spread out more. Okay, if I elevate my heel, what that's going to do is it's going to put my foot into more of a plantar flexed and inverted position, or supination. Your arch is going to be higher. That's going to be associated, that is essentially external rotation at the foot. And being in that position is going to bias more external rotation throughout the leg, which is going to favorably improve or support the mechanics that I'm trying to drive at the pelvis.
Right. The stack.
The stack.
They're more stacked.
Yes, absolutely. On the flip side, for a hinge, I have the exact opposite mechanics. I'm actually going to have more, when I dump the pelvis forward into anterior tilt and I shift my hips back, I'm going to have more adduction and internal rotation happening at the pelvis. Not a lot. You're not going to have like knock knees and things like that, but that's just a comparison of those two motions. When I am in a flat foot position, my foot is going to be biased more towards dorsiflexion and eversion in comparison to a heel elevation. Doesn't mean your foot's flat. That's just the bias in comparison. If I dorsiflex and evert the foot, that's going to bias more. It's more of an internal rotation at the foot. That's going to bias that up at the extremities. And that's going to promote favorable positioning that I need at the pelvis to complete a hinge. So it depends on what you're trying to do in terms of should you do everything barefoot versus not. Why is it harder to squat barefoot than it is with a heel elevation? Well, it's because with the mechanics of being in a barefoot position, if my foot is going to be more dorsiflexed and everted, well, that's going to bias more internal rotation in the extremities, which is going to counteract the positioning that I'm trying to attain with the squat. So what inevitably ends up happening is one of two things. Either you can't squat as low because you can't get the maximal posterior tilt, or you end up making your squat looking more hinge-like, which in my mind is not what I'm trying to achieve. So you have to ask yourself, what am I trying to accomplish? Am I trying to drive things that get more of a posterior tilt and subsequent vertical displacement, or do I want more horizontal displacement of the pelvis or an anterior tilt? And if you want more of an anterior tilt, then you could use barefoot to help your cause. If you don't want that, then you probably want to be in shoes, ideally with some type of heel elevation. So both are good. It just depends on what you're trying to achieve.
The goal, right?
Yeah. Now, if I got someone who's got a flat foot, I might heel elevate the snot out of them because they're going to have that bias, especially if they don't have the ability to attain a full squat. If I got someone who has super high arches and they can't pronate, they might do well with doing barefoot training. So it just depends on what you're trying to achieve.
I like it. So while we're on the topic of barefoot, let's talk about shoes. This is definitely something I've experimented with over the years. And just recently, I purchased a new pair of sneakers, and for a good amount of time I was wearing, like more shoes that were more geared towards fashion, Nikes, a lot of Nikes, Air Forces and stuff like that.
Yeah, give me two per, as the great philosopher Nelly once said.
And it's crazy because I had a pair of Asics 21 gel Nimbus, something like that, a couple of years ago. But I didn't know what I know now about shoes, about having a stable heel counter, stuff of that nature. And basically yesterday I got some, and game-changing stuff, man. Like, and I've been noticing with the Nikes I've been wearing that I could feel my toes a lot, and I felt really comfortable in that position because I'm more. A lot of my weight is still shifted forward to a certain extent. So when I
Yeah.
wear like the A6, it puts me in a position where I'm forced to be more on my heels, and it gives me a new reference. It gives me a new sense of the ground. And yeah, so the question is, should people care about wearing shoes with like a stable heel counter? What should somebody be looking for when purchasing a pair of shoes? I know you're gonna be like, I know you're gonna say depends on the goal.
Yeah. Stole my thunder, man.
I knew you were gonna say that, but generally, let's just say it's not for lifting. Let's say it's for walking. That's the goal, is to be able to walk around.
Yeah.
What should someone be looking for in a shoe?
Well, so here's the ultimate goal, in my opinion. Because I used to be very big on shoes. I still am, but less so now. The goal should be to be able to wear whatever shoes you want and not falter because of it. Because all you're using
Okay.
shoes to do is be able to find and feel certain things that you might not be able to just innately. So, and that's like another reason people will utilize orthotics sometimes. So, for example, let's talk about you, Phil. So you can't feel your heels in your Nikes
As much.
as much. So you, in this case, think of it, it would be kind of like, let's say I'm spotting you and you're benching, you know, 315 for 10 because you're jacked and you're strong.
Yeah, fucking right.
And
Soon.
soon. Well, hey man, I'm gonna be in Montreal in September, so
Not
that's how
that,
much
not
time you
that,
got.
not that soon, but
um,
one day.
and let's say you're like, yo, I need to hit 10 reps with 315, and 8 you start slowing down, and 9 it's like we start doing that. It's all you, bro, but really I'm helping you about 50% of the time. So getting a good pair of shoes with a staple heel counter is kind of like the it's all you, bro, right? If you can't get the heel contact that you need to be able to do whatever it is you need to do, you can utilize a more supportive shoe to um, to get that heel contact, and that's really what it's about. I'm using that as a means to assist my ability to feel whatever it is I need to feel. I'll give you another example. Let's talk. We talked about like someone who has a super high arch and they can't dorsiflex or evert. I could justify utilizing a zero drop shoe for that person, right? Where the heel sits lower than the front part of the body or of the forefoot, um, as a means to reinforce the mechanics that that person needs. So, or how about this? If I have someone who's got a stiff big toe, maybe they have hallux rigidus, where you have like inflexibility of your big toe. And, I need that big toe to move during push off and gait. I could use something like a Hoka that's just stiff overall that eliminates that piece of the gait cycle in order for that person to complete the action. So there's not a one size fits all recommendation for shoes. It really does depend on what you're trying to achieve and accomplish. So if you can't feel your heels when you're walking, and you've done a lot of activities and exercises to encourage that. Maybe you've worked on the stack, you're working on your squat, all of this stuff. You're doing split squats and things like that, but it's still really hard to get heel contact, and that's impeding your ability to feel what you need to feel in the rest of your body. In that case, it might be like hamstrings and glutes, and you need a little bit of extra sauce to make that happen. Something like a shoe with a stiff heel counter can be useful because what that does is it allows for more control and support at the calcaneus, your heel, so you're not falling into compensatory strategies. But my hope would be, Phil, in your case, is that you use a shoe like that for a while, and eventually you get to the point where you can feel your heel in your Nikes. And maybe maybe every once in a while you got to go back to your Asics, but it's not something that you have to be stuck in. And I think that's one thing that early on in my career I was a little bit more dogmatic about. It's like, oh, you got to have good shoes or you can't work with me. But then here was the problem that I ran into. I worked with a lot of poor people, can't afford shoes.
Mm-hmm.
I worked in a lot of underserved populations. And what are you going to do? You're going to ask them to go out and pay the $160 to go get the newest Asics? It's like they're having a hard time affording rent. So
Right.
You still have to take care of the basics first. You still have to be able to stack. You still got to be able to work on your ability to squat, hinge, push, pull, do all of these things first. And shoes are merely a way of accelerating or making your ability to get your body into the positions that you need to a bit easier. But you shouldn't have to be stuck in them either.
I'm just gonna throw it in that I never got the shoes with the attitude that they were gonna fix my problems. You know, I was just thinking, okay, I want to put more of the odds in my favor.
Yeah, absolutely. So
wearing shoes, might as well have shoes that are gonna
yeah,
that are gonna give me that reference and make me feel the right things, as opposed to just getting like crappy shoes on purpose. But I definitely understand the point that you're trying to make, is that the goal should be to be able to wear what kind of shoes you want.
Yes.
That's like the bigger picture.
Absolutely, absolutely. And the reason why I say that, Phil, is because there are some people who aren't that dogmatic about shoes. Like, I had a colleague who I worked with a while back, and I remember he said, like, to a patient that it was post-op ACL, that, like, if you don't buy these shoes, I'm not gonna be able to help you. And it's like, I think most people can be helped. Like, you still have to consider that we are incredibly adaptable human beings and creatures, and the body can compensate in many maladaptive ways, but also adaptive ways. And please, just like with anything, before you get fancy, before you go out and you buy the fancy Asics, make sure you can stack, make sure you can get your body into positions you need to. And if you want it, in your case, Phil, which I think is totally wise, up the favors, or up your odds of success, I should say, then by all means, get shoes. Or if you can't feel what you want to feel, then that would be a good instance to get good shoes as well.
Right. I guess a good this is kind of similar to references in the gym, because sometimes you'll see people who can't, for example, feel their adductors. So let's say they're benching or something, and they'll put like something between their legs to get them like out of ER, and feel their adductors firing. But the goal would be to eventually get rid of a lot of these references, kind of like the shoes, whereas like the foam roller is kind of like the A6. You know what I mean?
Yeah. Or how about this? Like doing machine work versus doing free weights. Right? Let me give you an example. I actually love machines because I get a ridiculous pump. But let's take someone who, let's say you get a client who is morbidly obese and they're taking those initial steps to towards fat loss because they want to be healthier. Maybe they want to live longer. They want to do all of these things. So kudos to them. There might not get much out of the traditional free weights that we have in the gym, because the increased adiposity that they have can be a rate limiting step to getting their body into positions that they need to. There's a video on my YouTube where I have how belly fat can negatively impact your squat or something like that. And I had two different scenarios for myself. One I affectionately call Fat Zac. The other one I affectionately call Less Fat Zac. So in the first one, Fat Zac, I was about 204 pounds.
Yeah, I saw it. I saw it. Yeah,
Yeah, and
I
then in
saw
the
it.
other
Yeah.
one, I think I was like 177, which is what I weigh now. When I was 204 pounds, I could not squat all the way down.
It
And the
affects
reason
your
why
mechanics. Yeah, for sure.
it does. So essentially what happens, right, is I had all this visceral fat and I couldn't move that visceral fat in a manner that allowed me to squat all the way. So I lost depth. Drop the chub, now I can squat a little bit more effectively. All right. Now take that to someone who's morbidly obese. Maybe they're 300 plus pounds. They're going to have a hard time getting into a lot of positions because of that structural impediment that they have. So, but they still got to train. Training is still incredibly important. I still need to preserve muscle mass as I'm starting to, and gain muscle mass as I'm starting to decrease, calories and things like that, so I can drop some of the fat. So machines can be a useful orthotic
Right.
to getting the same things, with the eventual goal, maybe the eventual goal being putting their body in the positions that they need to be able to get into so they can maximize their movement options. Shoes are no different, right?
Right. I'm sure there's still some 300 plus pound people who have good mobility, but like I get your point. Like
Yeah,
they'd
well,
have better mobility if they were to lose a little bit of weight, for
yes,
sure.
yeah,
Unless they're like 8 feet tall or something.
yeah, yeah,
Like
yeah, 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 yeah.
yeah. So okay, so we're approaching near the end. So we were talking about patterns at the beginning. Let's talk about stretching because this is a very controversial topic. I actually got into a heated discussion with
Really?
one of my close friends about this, and I was talking about how if someone's stuck in a pattern and they're doing a lot of like static stretching, the static stretching is not going to do any miracles because they have to address like what you're saying, the stack. It's just a different way of saying what I was saying.
Mhm.
And he was saying how it was just a heated debate. I'm not going to get into it, but what are
Are
your
you two still friends?
no, I'm joking.
Yo, yo, yo! If you're into stretching, man, I can't mess with you. I feel you. I feel you.
Yeah, but and even myself, like I don't want to get too carried away into it, but like if you rewind, and a lot of my subscribers know this, like around 2 years ago, I was always complaining about tight calves, and with what I know now, what I've known like within the last like year, a lot of my weight was shifted forward, and I did buy the calf stretcher, and I was stretching my calves a lot, like at work, and I'd be like on an escalator, and I would just have like my tippy toe on, and I would just like put on my weight. I made videos on calf stretching, and it's funny because a lot of my videos where I don't agree on what I was preaching today, I'll still, it's kind of controversial if I should keep them up or not because I don't agree with it at all. But a part of me just says keep it up because it'll show how much different my philosophies are today. But long story short, I was stretching my calves like no tomorrow. And if anything, they were just getting tighter by the day. So I don't really think, I think if someone's really stuck in a pattern, they can still stretch. Maybe they'll get some kind of relief, like some kind of like placebo effect or something. But I tell people don't expect like miracles from stretching either, from my perspective. But what are your thoughts on static stretching?
Yeah. I don't. It's not something that I really program, and for a few reasons. The research on static stretching is pretty lackluster in terms of efficacy. You're not changing the length of tissues by any means. If anything, you're increasing your tolerance to stretch. So, I go do like a toe touch stretch and I get pain in my hamstrings. Well, if you practice that enough, eventually that pain will subside. So, if you need to do that, then fine, whatever. Go ahead and stretch till your heart's content. There might there is some research, and it's been a minute since I've read it, that shows that actually stretching post workout may increase. It was either hormone. It was like I think it was hormone placement into some of the tissues that you've worked, which is kind of interesting. So maybe there's some utility in that. But again, it's not really something that I practice much. And the reason why is because let's say you have someone who's stiff in all directions and they're told to stretch. Well, I got a knee joint here. If, let's say, I lack knee extension and I lack knee flexion, so I can't bend, I can't straighten my knee. Well, if I zoom into the joint, there should be some space. There should be some space available between the joints in order for me to move in all directions, because what that's going to do is it's going to allow me to push synovial fluid in all directions in order to complete my ranges of motion. Well, if I'm tight on the front and the back, that joint space is going to relatively reduce compared to the person who has full range of motion. You're not going to be able to stretch your way through that, because I need to be able to create some type of gapping in order to make the synovial fluid move in all directions. So for that type of person, stretching is not useful. For someone who maybe has a unilateral restriction, I could fathom stretching potentially working in that situation, but it's not what I like to utilize, because I would rather use contraction to elicit the changes. But what do I do about someone who's got the reduced joint space? Well, I need to choose activities that would create gapping. Being able to change the more proximal structure, in this case, the femoral positioning, may be a way of influencing that gapping. And how can I influence the orientation of my femur? Boom. Well, the orientation of the femur is going to be influenced by the orientation of the pelvis, which is influenced by a lot of the stuff we've been talking about. So breathing, being able to achieve the stack position, those things. So I would agree with you. You're not fixing the underlying issue by stretching. Like, things are restricted for a reason. And likely the reason is twofold. I have this existing bias that I have based on my structure, and I'm trying to manage gravity. And so teaching yourself to maximize your movement capabilities within your structure and better and be more successful anti-gravity are going to be a more useful strategy for creating the changes needed locally at the area you're trying to improve your motion. And that will likely get you more success than stretching. I mean, the research has pretty much shown that stretching isn't effective for the reasons why we think. So let's see if we can find a better strategy. Based on my biased clinical experience, which is biased, I've gotten some pretty substantial range of motion changes in people without using static stretching, and I think it's more useful, one. Two, I think if you can move, there's more of a learning component involved, so I think there's better carryover as opposed to trying to stretch to your heart's content.
Right. Would you say the same thing or something similar about foam rolling?
Yeah. I would say the same thing about manual therapy too. Is I think in those situations, if I do something that's more passive, I would almost place them in the shoe category that we talked about.
Right.
Foam rolling might be able to get you to sense something or get you into a position that you might not otherwise achieve. And maybe you could say the same thing for stretching, but it's not going to trump your ability to get into that position on your own or with the assistance of weight or things like that. Like, if you can do it actively, I would do it actively. Now, if someone likes foam rolling, they like how it feels. I mean, sometimes I foam roll when I'm, bored to tears. I'm not going to dissuade someone from doing that. Same thing with stretching. It's like the costs of doing these modalities it's not going to break you, but are the benefits good? Maybe not. I think you're probably better served doing other things in place, especially if you have a time constraint.
Right. If you have 1 hour with a person,
yeah,
spend like 10, 20 minutes foam rolling and then stretching.
Yeah. Yeah. I'd rather have my peeps
good money
for the session. Yes. 100%.
Yeah. Okay, so here's a cool question. Let's talk about cueing. Because you see a lot of personal trainers on Instagram, YouTube, different kind of platforms. And a lot of times you'll see them coaching other people. They'll be doing maybe one-on-ones, group classes, stuff of that nature. And what I like to look at is I like it to see how they're coaching other people, because maybe there's something that I could potentially learn from them and possibly apply to my coaching. Maybe they're doing something that I'm not doing. And then, so one thing I'll look at a lot is cues. And I've been realizing over time, I know I'm talking pretty slow. I'm just trying to gather the thoughts.
Oh man, I love it. It's good.
I've been realizing over time there's certain cues. Well, because I've worked with different coaches and I've been coached by different people, and I've looked at a lot of different coaches on YouTube as well. So I've got a good feel of the surroundings and like the different kind of coaches that there are, and people who are qualified in different categories, if you will. And I've noticed that the better coaches that I don't want to say whatever, the more advanced coaches that I've worked with, the people who have not necessarily more years under their belt, but you get what I mean.
Yeah, absolutely.
They tend to use certain cues that your average, Joe Blow, like personal trainer won't necessarily use. So what I've realized is that a lot of coaches will, long story short, a lot of coaches will say cues that don't really mean anything. Core tight. What does that mean? Whereas like the last two coaches, well, the coach I'm working with right now and the coach I worked with before, the cues, they resonate with me a lot more.
Yeah.
Drive your heels in the ground. Like there's certain cues that I just like, okay, this makes sense. Are you sensing this? And like the word choice, as opposed to feel this, it'll be like, do you sense this? So not just the vocabulary, but the way it's just not vague. So in your opinion, and I know you're probably gonna say, well, it depends on the exercise, depends what exercise I'm performing. But what are some cues that flat out like are just not doing anybody any good?
Ooh, that's a tough one.
You hear core tight a lot.
Yeah, yeah. Well, first off, I like that you are deliberate with your words, so don't lose that. So I do want to say that. Don't apologize for taking your time. Second off, cues that I think aren't useful. So I think any cue, this is going to be a little bit of a cop-out answer, but I think there's a good reason for that. Any cue that doesn't resonate or get the movement change that you're looking for isn't useful. And I don't think there are, I mean, I have cues that have a higher probability of success with than others, but I don't think there's like a magical cue that's going to fix anything. What you have to find is a cue that resonates with that person and that makes sense to them. So let's take core tight, because I would agree with you like that. I think it's a fairly useless cue. Because especially if you work with a general pop client, and maybe this is the first time that they've ever exercised in their life. They probably don't have the body awareness to tighten their core or tighten their glutes or things like that. So what I like is creating analogies that people can resonate with to get a certain movement to occur. So like even, let's use an example like tuck your hips or posterior pelvic tilt. Sometimes that's really hard for people to conceptualize, right? Hip tuck. Or, even to feel your heel or drive through the ground with your heels example. Well, what if you have someone who can't feel their heels? Might not be the best cue. Whereas if you can find analogies or things that make sense to the person, that can be really useful. And I'll give you, actually, it's funny you asked that question, because this shirt that I'm rocking, they're Jay-isms. My colleague Jay Chung, he's got like some of the best cues ever. And one of my favorites that stands out for teaching a posterior tilt, which we need for the stack, would be comparing Jennifer Lopez versus Michael Jackson. So, if you think about J-Lo, right, she got the big old booty, sticking the butt out kind of thing. That would be an anterior pelvic tilt. Whereas Michael Jackson, rest in peace, grabbing his crotch, that would be your posterior, your tilt. So a lot of times what I'll do with clients is, if they're not getting the cue, well, most people know who Jennifer Lopez and Michael Jackson are. So I'll say,
Right.
hey, I want you to do a J-Lo impression, and I'll demo it myself. That's another great way you can get someone to get a concept, is demonstrate things with your body. Show them the position you want and show them what they're doing within an exaggerated fashion. So let's say I have someone and maybe I try tuck your hips, or I like guilt your belt buckle to your belly button, and they do
Right.
something,
Yeah.
they arch their back, right? I'll show them, I'll say, hey, I want you to be a little bit more like Michael Jackson. Tuck your hips. You're doing a little bit of Jennifer Lopez or Kim Kardashian. I'll just arch my back, stick my butt out, and make a duck face or something because I'm weird like that.
Right. But you're speaking to them in their language.
Exactly, and that's what it's about. And really, I mean, that's everything with us, is we have to meet the client where they're at. So they might get a laugh, but they're going to remember, oh snap, I'm looking like J-Lo on this move.
Right.
And I need to un-J-Lo, or I need to be more like Michael Jackson. And then I'm going to apply that concept with every exercise in which they need that. So like in my case, if let's say I'm coaching someone to squat and they're arching their back and I try the MJQ and that's not enough, I might drill down and go with an easier exercise that mimics the squat position. So maybe that's a hook lying posterior tilt, with your on your back, knees bent. And it's like, hey, okay, you remember when you did that here? Now I need this in quadruped, which is an easier position. Well, guess what? That's 90 degrees of your squat. Now I've taught them, oh crap, I see what you're doing here. This is the same thing that I'm trying to do in standing. And then I'm getting carryover. So what you want to do is you want to find cues that resonate with the client, and then you're using them throughout. Like I have a guy right now who he's like a rehab client who I do a little bit of training with, and I've worked with him for the last few months. And like at this stage in the game, I really don't have to coach him much because I use literally the same cues. And it's like I have conversations with him about like, well, how did that feel? So now that he's built awareness within his body of what he needs to feel, now I have him tap into that. I have him think and reflect. How did that motion feel? Well, I felt something I felt my hip flexors working a lot during that move. Well, it's like, well, what do you need to do? Now he gets, well, I need to un-J-Lo myself.
Mm-hmm.
Whereas maybe a month and a half ago, he might have been like, well, I don't know. It's like, that's where I demo, well, man, you were really J-Loing on that squat. I need you to un-J-Lo yourself, or I need you to tuck your hips, or I need you to, my favorite cue for a posterior tilt is like squish your butt flap to your thigh.
Right.
You just have to find something that resonates. And if you're utilizing nomenclature or jargon that, Phil, you and I might talk about with a client, that's probably not going to resonate with them. So meet them where they're at from a coaching standpoint, not just with cues, but with everything. And if you do that, then you're going to reach your clients better and you're going to likely be more successful. And that's where I think, it's useful to interact with a wide variety of people. It's useful to read widely so you can speak to a wide variety of people and interact with people who are different than you, because then you have a larger pool of things and analogies to choose from.
Yeah, I like that. That's what I'm trying to do myself too. Is really just build the best rapport with the client and really ask the right questions and get to know them as well as possible, and then I'll be able to speak in their language. Yeah. And give them the right cues, because a lot of these clients don't want to be coaches anyways. So they don't care how it's really explained to them. They just want you to get the point across.
Yep, and the result.
Yeah, that's really what they want. They want the result, and Einstein even said, like, if you can't explain it to a 5-year-old, then you don't truly understand it. So it's like if a coach just knows how to explain it in these complex terms, but the clients don't understand it, then what's the point?
Precisely.
You're learning all this stuff to apply it to somebody.
Yeah. Well, and that's true mastery, is if you can take the complex and then make it simple so anyone can understand it. And doing so with a client who isn't in the field is probably the ultimate expression of that. So if you're still using jargon to explain it, then you might not have the mastery. One, or the other possibility is you're dealing with an ego issue and you need to do something to squash it. you need to get fired from an important job.
Right, right. So give you a couple more, then we'll just wrap up. So
Love it.
okay, give me a sec here. So let's talk about crawling. I feel like this is an exercise that has a lot of variations, and it's not really talked about too much. And I've noticed on your channel you talk about crawls as well. And I know
Yeah.
that like they help restore the ZOA. A lot of people, a lot of coaches will use them for warm-ups. There's a multitude of different benefits, but where would you incorporate a crawl, if you do incorporate a crawl into a certain client's program? And what are like a couple of like, a handful of benefits that people could get from basic crawling variations?
Are you talking just like crawling on the ground, or are you talking like a bear crawl
Bear
or
crawls.
a bear crawl? Okay, yeah.
Yeah.
So with a bear crawl, so a few different things. We have to look at. Let's assume a forward bear crawl first. Or
Right.
actually, before we even do that, let's just assume the static bear position. So you're on your hands and you're on your feet, knees up in the air. So let's look at a couple things. What does the quadruped position do first, or the bear crawl position first, right? So I have gravity pushing down. So if we go back to the person who's got the crazy six pack, right? The guts are going to be more forward into the ab wall. So that could stretch and enhance my mobility there. So if I have someone who has that crunching bias and they can maintain a good resting bear position, that could be a useful move for getting that to eccentrically contract, or eccentrically orient. With 90 degrees of shoulder flexion and roughly 90 degrees of hip flexion. I don't want to dive too in depth into the biomechanics, but I got some posts on my site that go into it. But the relative position of those two bones is actually going to bias more expansion or stretching on the front side of the body. So in the uppers, it's going to allow the chest to move better. You're going to have more anterior chest wall expansion. And then in the pelvis is going to bias more movement into the anterior aspect of the pelvis, for lack of a better term. So with that in mind, if you have someone who has restrictions in any extension, adduction, or internal rotation measures, if you look into that, bear crawl could be useful. We didn't dive too much in the narrow and wide infrasternal angles, but if someone has a narrow infrasternal angle, could be a useful move. So that's where I like the bear crawls for those individuals in particular. Now, who is bear crawl not for? Well, if you have someone who is already tight in their back, maybe someone has more of an extension bias, and they're going to be more limited in more flexion, abduction, and external rotation-based measures. Actually might not be the best move for them right away. Mm-hmm. So you might want to do things to get expansion back there first. So maybe you use a crab walk instead of a bear crawl to elicit that same thing. And then maybe you're going to a bear crawl. That being said, if I have some expansion, I need to work on my ability to go overhead, which does need some degree of expansion in the upper back, but let's say I have good mobility, below that, like in the lower part of the thorax and the pelvis. You could use retro bear crawls to reinforce that positioning, because now I'm encouraging scapular upward rotation. If I get a full reach, I'm going to encourage some nice shoulder flexion. So there can be a lot of utility in bear crawls, but you have to watch and see who you're programming this for. If you got someone who's got a super flat back, you might want to unflatten that person before you go with the bear crawl. But if you got someone who's got slouched posture, rounded forwards, things of that nature, that could be a useful exercise, assuming they can keep a chest parallel position to employ to encourage expansion and stretching on the front side of the body.
While we're on that topic,
mm-hmm.
when you see someone with a slouch back, I think it was Connor made a post about this, but I want to hear your opinion on it. People say it's a flexion problem, but apparently it's an extension problem. Is that true? Is it a
Ooh,
compensation strategy?
well, I would agree and I would disagree. Okay. Because I'm certain I know why Connor is saying why that is. And correct me if I'm wrong, because did he talk about this on the podcast that he
No,
was
it was a
on?
post. It was a
There's a
post.
post. Oh, okay, gotcha. So what because I think I know who he's drawing from. He would say that if someone is hyperinflated, they would, so that would be extension, and they would have a compensation falling forward. So they'd be in hyperinflated extension posture, but then they compensate by trying to create a zone of apposition by flexing forward, right? So it's like I'm flexing, but I'm extended to start. I kind of disagree with that to some extent. So if I see someone with a slouched posture, here's what I know. I know that they lack expansion in the chest wall, because if I can't expand in the chest wall, then the sternum's going to bend forward, and that's when it's going to get the crunched position. So the degree that someone is extended versus not in that position depends on how much motion they have access to on the backside of their body. Right? If someone has a loss of shoulder flexion, abduction, and external rotation, because that tests extensibility or mobility on the backside of your body, then that person is possessing a bias towards extension in that orientation. And a lot of times what you'll see in that case is when they slouch forward, they're hinging at only a few segments in the upper back. So you'll see, I'm a good example of this. If I slouch, you can see how like I'm flat up top, I'm flat down low, but I kind of bend somewhere in the middle of my upper back, right? So that's me hinging at a few segments to try to create flexion. But I could envision someone who has the ability to expand in the upper back who still could have that positioning. And that person would not be someone who is more extension biased. They would be more flexion biased. So it really depends on how you're getting into the slouch.
Hmm. Interesting.
Yeah. It goes much deeper. Like we can't classify everyone into extension. And one thing too, I don't like living in extension, because just because you might have a bias towards that, it doesn't mean that you are good at that either.
Oh,
What
yeah, definitely.
what
Yeah.
really
No,
is,
yeah, of
right?
course.
It's there's a loss, there's a reduction of your options to get into various positions. And some people are more biased on the extension side of things, but also too, there can be some people who are biased more on the flexion side of things. So it is different in that respect.
Yeah, I think it was Kyle Dobbs or someone who talked about how just because you're stuck in an orientation doesn't mean that you're necessarily going to dominate it either.
Yeah, for sure.
Okay, so we're gonna wrap up. Just one last one, and then maybe one, or maybe two or three. Let's talk about knocked knees. So
Cool.
oftentimes you'll see people who have knocked knees, and then people will try to correct that by like putting like a mini band or something between the knees. So you mind just explaining where could the knock knees come from?
Yeah, great question. So if the pelvis,
Or knocked
we
knee?
have to, yeah. So we have to ask what's going on at the femurs when I have knock knees. The femurs are moving more towards internal rotation. So they're going inward, right? Think about your clamshell. Clamshell's the other direction, right? It's external rotation. So if I'm the opposite of clamshelling, I'm going into more internal rotation. Okay? So what can happen at the pelvis that would bias the femurs into more internal rotation? If it dumps forward. If the pelvis dumps forward into an anterior tilt or an anterior orientation, the acetabulum is going to be biased more into internal rotation, and the femurs will follow suit oftentimes. So then you have a knock knee posture. You especially see this on someone who's jumping and they're not good at creating vertical displacement. So what happens is they'll shoot their hips back and the knees will touch. So is the fix to drive the knees out and put a band around the knees? Not necessarily. The fix would be to get someone to create posterior tilting of the pelvis, aka it comes back to the stack.
Right.
Gosh, that's like the third rhyme of this talk. That's pretty good for me. So if you can't stack, the band around the knees is probably not going to be the fix. That being said, sometimes you can use the band around the knees, but not necessarily drive knees out crazy to get that same positioning, because what can happen is if I'm driven way far into internal rotation at the knees, I might place a mini band around the knees to bias me into some external rotation, but also to fix the femurs in place so I can drive pure mechanics through the pelvis. It would be like fixing one end of a bone to move the other, so to speak. So in that case, the bands could be useful. But what I wouldn't say rarely, I actually have been doing this a little bit more, but I will rarely drive the knees out to elicit that adaptation.
Right. So they're there as like a new reference, so you could bring them out a little bit, but you're not going into like a powerlifting.
No,
like
because
you're not driving them out and like.
No, because actually, it's funny you mentioned powerlifting. When you do that and you abduct the femurs, it's going to inherently limit depth in the squat. And as you hit certain ranges of the squat, there's some good research out there showing that actually drives internal rotation of the femur. So it's an abducted and internally rotated position at the femur when you go with a wide stance, because when you go that wide, you don't necessarily get the counter nutation, or actually the posterior tilting, I should say, of the pelvis. It's you are able to sustain a more anteriorly tilted position, and because the anterior tilt is biased more towards internal rotation, it actually drives more IR as you approach lower depths.
Okay, so we're gonna wrap with the Q&A.
Cool.
That was the last question. Yeah. So you have any final words?
Make sure you stack. That's probably the biggest thing I would say. No, man, this was an incredible conversation. You asked amazing questions, so thank you for having me be a part of it. And for those of you tuning in, I appreciate you taking the time to. Hopefully, you made it to the end, and I did bore you to tears before that. But yeah, this was a lot of fun. And Phil, I thank you, man. I love what you're doing. So keep doing you. And folks tuning in, keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, and stay moving.
Yeah, to everybody who made it to this part of the Q&A, you guys are real MVPs. If you want to find Zac, you mind telling us where we could find you?
Yeah, for sure. So ZacCupples.com is my website. That's ZACCUPPLES.com. That's where I house almost all of my content. So, I got a newsletter there, which you'll get access to a lot of free stuff. You get like 5 hours of talks, access to my free course, a workbook that allows you to look at movement under this lens. So it really simplifies some of the compensations that you'll see with common movements like a squat and all that. And a lot of my services are there, access to my seminar, Human Matrix, if you want to attend that, which I'll be in Montreal in September, is there. Otherwise, I'm on Facebook and Twitter. If you search Zac Cupples, I'm on that Instagram, baby, at my full name, Zac, Zac Cupples, CUPPLES. And then I'm also on YouTube. If you search Zac Cupples, you can find me. That's where a lot of my exercise videos and some of my show, the Movement Debrief and the Zac Cupples Show, exists. So those would be the places that I would find me. I hope to see you there.
Nice, man. I know I got a lot of value out of this, and hopefully I'll try to sprinkle in some of what I learned into my videos. And yeah, man, it's all about the stack.
Yeah, and if you can't stack, don't talk to Zac. So
I appreciate
thank you for
Zac.
having me, man. This was fun.
Thank you so much.
Appreciate you. Take care.
Thank you.